Hello, today is Friday, February 4th, 2022. I'm Megan and I'm here today with Dr. Jill Jim. Could you please introduce yourself, tell us who you are, what is it exactly your role is? Just tell us about yourself.
Well, I'm Jill Jim. I am the Executive Director of the Navajo Department of Health. I am currently in this position for starting on our fourth year of a four-year term in the Navajo Nation. And I have a degree and a doctoral degree in public health, and also have experience in public health and working in state, local, and federal agencies prior to this position. And also the work that I do every day relates to responding to the COVID-19 pandemic. The Navajo Nation Commission of Emergency Management authorized the department to oversee the public health emergency response to COVID. And so I've been also heavily, I guess, in that role now and in the last 2 years as well with the Navajo Nation.
Oh, so you are a busy woman. I guess we're gonna actually ask, can you take us back to what were you doing really in December 2019 and how did you initially get involved in the pandemic? Like what was kind of your intro? What was happening all around you then?
Well, in December 2019, I don't believe at that time there wasn't a lot of information about COVID, and it really hasn't reached the United States at that time. And so I was still traveling and attending a lot of meetings, just doing regular business for the Navajo Nation and advocating for healthcare services for the Navajo people. So that's what I recall in 2019. And as you mentioned, you're probably wanting to know, well, how does that tie in with COVID-19 since it was first identified in 2019, but it really didn't reach the Navajo Nation. Our first case of COVID-19 was in March of 2020. And I didn't really get involved with understanding what COVID was and how it would relate to the Navajo Nation till the end of January 2020. But we were starting to hear about it early January, and I was still traveling around that time in January. So in December 2019, I was still doing my regular responsibilities and making sure that, as I mentioned, to ensure that the Navajo people are receiving the best care that they can regarding health services and other areas across the Navajo Nation.
So once you guys did have that first case on the Navajo Nation in about March 2020, how did you end up becoming engaged throughout the pandemic? Like what did you guys first do to respond? Like how did the Navajo Nation respond to the pandemic, I guess? And in your role, what was your role in doing so?
Yeah, and I think you'll hear two different perspectives. There's always a perspective from the leadership perspective and perspectives. So I think I'll go from the lens of the public health perspective. And it was a lot of education, and I can kind of talk about the first month and educating the Navajo legislators about our role in public health and what does that mean, and how do we integrate our existing disaster response to a public health emergency response that included something that we could not see, we could not feel, we could not touch. It was sort of the explanation of understanding what we were dealing with. And we also had to give it a name in Navajo as well. And we do call it the big cough, or the big pneumonia of 2019 is how we translate it in Navajo. And so that was sort of the response up to the first case, is a lot of education and understanding of what it is. How do you translate the signs and symptoms of the disease in Navajo? How can you prevent getting the virus? And how do we try to compare it to existing respiratory illnesses so people can relate and sort of understand what they needed to do to take action. So As I mentioned, we named it the big cough, and that relates to, well, what do you do when when you are trying to prevent a cold or pneumonia? And those are the same precautions that we wanted to provide. So a lot of education had to be done, and then we also had to increase our response by creating a team we thought would be helpful in the response, meaning that we had to link up our healthcare systems and also our local and state partners and federal partners to come on Navajo, because after the first case hit, we were one of the ones that had, in comparison to New York as the epicenter, we actually had higher rates than New York at one point based on our population early on as well. So our surge patterns are quite different. And that's one distinction that is in comparison to the United States. We experience a higher surge similar to New York early on. And so a lot of actions had to take place, and that means the Navajo Department of Health had to use its authority to institute laws to wear masks and to shut down one community and reopen, and put in mandates and therefore closures and also curfews.
Well, you guys had to implement a variety like everyone. So what do you think were the unique challenges that you had to face as being the Navajo Nation? You mentioned that you had a similar rise early on in the pandemic, similar to New York. But one thing that's come up a lot is just doing like science communication and that's just education. How did you guys try and just educate everyone during the pandemic? Were there any particular policies that you pursued, or what was your goal? What were your goals?
Well, we couldn't do face to face, and that's traditionally how people communicate. But as you know, on the Navajo Nation, we have a lot of broadband issues. So not everyone has internet, not everyone has clear phone reception, and not everyone has electricity. So communication was very different early on how to convey messaging. So we have to use their radio stations that were local, and even with that, the radio station was shut down, and we had to go in there and get special permission with limited people. And we did forums to bring in clinicians to explain the virus in English, and then have that all translated in Navajo. But a lot of our speakers, our elders, do speak Navajo, but we do have a mix where the younger generation does speak more English. And so we had to use social media and town halls that was instituted by the Office of the President and Vice President. So President Jonathan Nez and Vice President Myron Lizer had a lot to do with their participation early on in providing information to the public. And today we still have weekly COVID-19 town halls to give information about where we're at, where the numbers are, and what we still need to do. And so we had to also build a dashboard on our Department of Health webpage that is alive, like a sort of an interactive map that can show where the numbers are since the beginning of the pandemic, which areas are impacted and which age groups are impacted. So a lot of the information early on, we didn't have the capacity to do that. So we relied on the newsletters that the Office of the Vice President or President and Vice President issued out. So people were waiting for those numbers to be published in order to gauge what was going on. So as the pandemic progressed, we finally decided to build that capacity. And now we have sort of that data available for everyone to kind of can see. And it also updates retrospective lab results for COVID-19 as well. We had our highest number recorded like a couple weekends ago at 500 new cases in one day. And when you look back at that number, when we put data back in, because lab results come back later, it's actually more than 500 now. If people pay a little bit close attention, because we do go back and fix and clean data and throughout the pandemic with what we have. So it's neat that we have that available for the public, and it's accessible for people to see where we're at. And we also identify communities through weekly newsletters, letting them know if they have uncontrollable spread or not. And it's really up to these 110 communities to use that information to do any prevention, or just leaders and community members to be aware that you have high transmission in your area. So it's better to maybe not host a birthday party, or to have a graduation party, or do any gatherings. But those have been sort of the messages that we use and convey using data to inform people. So, but face-to-face and interactions were limited. But when the numbers did go down, we were trying to go into like flea markets, like swap meets, to try to provide more education and prevention. But once the numbers went back up, we kind of went back to our response and crisis mode again.
Wow. So, I guess where would you say you guys are at now in the pandemic, where we have the vaccine is kind of available for all adults of the population? What would you say, where are you guys at now with the pandemic, and what would you say comes next? Like, what do you expect the next 6 months to look like?
Well, as far as the pandemic, we're decreasing like everyone else in our numbers. We are not experiencing high deaths or high hospitalizations like the rest of the country. So when we do hear news about higher hospitalizations and also deaths, so far we're not experiencing that. So it is likely due to the more vaccinated vaccinations. We are not at the vaccination rate that we will want to be at. I mean, as far as the whole total population, we still have at least a third of our population still needs to be fully vaccinated. Half those that have been vaccinated, close to 50%, I think, have been vaccinated. So just like the US, we still have to get everyone boosted, to get an up-to-date shot is what I think will be the focus, is getting everyone to be fully vaccinated. And we're working on our younger age groups and our 20 to 24-year-olds, which are the lower categories. And then we also focus on trying to get the up-to-date shots for everyone is probably what we're going to focus on going forward. I mean, we will have to eventually, or we are coexisting with COVID. We don't know when this will end. For sure, it's not now, it's not tomorrow. And we are working on sustaining public health measures, not only for the community, but for employers and also individuals now. And so we're transitioning to trying to figure out how do we sustain this moving forward. And so those discussions are happening, and we are working with our experts within our health facilities and within the Navajo Nation to try to build a better sustainable workforce, and also our response if there is another variant that could be worse than Omicron. But we know from the experience with Omicron, we definitely know that we didn't have the capacity to handle Omicron in some cases, but we didn't experience high hospitalizations, and we didn't experience a lot of deaths during this last Omicron surge, even though we had over 500 cases in one day. And so for that reason, I think, to be honest, even though our vaccine rates are slightly lower than we expect, but I feel like a lot of our people that are missing from the number of people that need to be vaccinated, I'm quite sure that they're probably working off the Navajo Nation, working in metro areas, and may have already received their vaccine. But we also are experiencing the unvaccinated individuals still experiencing higher sickness and more likely to get hospitalized. So I think that's the message going forward, is encouraging those that are not vaccinated to get vaccinated, and ensuring that they have access to vaccines, and which we don't have a shortage of, and also relying on testing as well, and also just becoming more aware and of just taking individual responsibility and contributing to preventing infection.
So that sounds like you've got some steps laid out going forward. You also have this other role, though, besides your role as the executive director for the Department of Health with the Navajo Nation. And in 2020, you were appointed to President Biden's COVID-19 Advisory Board. What has it been like? What has your role been on that board? And what have you been doing throughout the pandemic in that role? And what do you see going forward?
Well, I am thankful and have always been honored to have been selected by, at the time, President-elect and Vice President-elect Biden and Harris at the time. And my role in that COVID-19 advisory board was really up to the point of their inauguration to prepare them to respond to COVID on day one. And me and others that were on that board, we listened a lot to different stakeholders and communities of all sorts and associations across the United States. And I was very pleased to know that similar experiences that we were experiencing on Navajo were also seen in either African American communities or Hispanic communities. And just hearing and knowing that we have similarities, and we also have experienced more disparities in the pandemic, either through more infections or in some case we had higher vaccine rates, but then we still have other challenges in resource allocations and whatnot. So I think my role at the time was just providing advice to the Biden-Harris Advisory Board transition team on my perspectives and experiences and lens on ensuring that they do address those health disparities, and not only with COVID, but how to help the individuals immediately on day one. And I think we help prepare some of those in assisting with the plans that they did on day one. So that was part of my role, and I'm always happy that I was in that role and continue to just hear and see of the other advisors that have ongoing contributions to the work to date. And so I know there's been several publications and efforts around how do we live with this long term, and what do we need to do. And so I'm glad that I have that connection with them previously, and also continuing on to just see what kind of work happens out of their recommendations nationally. So it's been nice to see that and understand that there is a whole a lot of experience from different experts nationally that have been chiming in on next steps. And I think that's sort of the I guess the inspiration that I have on knowing that our people out there, that even though we might have challenges internally, but there is always hope that someone might have a better way to address the pandemic that we might not have thought of. So I'm always wanting to commend those subject matter experts that are publishing out there to give us sort of that glimmer of hope on what can be.
Well, speaking of next steps, and I think you're commendable in and of yourself, what are your next steps outside of just what do you see your next 6 months looking like?
Well, the next 6 months, I hope to continue to finish out the term here with the administration here with President Jonathan Nez and Vice President Leiser. We work on we function off a 3-branch system, and this is the end of the four-year term. So I hope to give the best that I can to provide the best COVID-19 response and addressing the Navajo people's health and well-being in the next 6 months, so we can be in a better place and figure out what we can do. But I understand that we are still in a crisis mode to some extent. We are trending down, but we can't tell what the future is, but we can try to prepare better each time. And from the lessons that we learn from each surge that we've experienced has been slightly different. And so it's always interesting just to keep learning from what we have experienced and trying to set sort of the expectation and managing and sustaining the response, I think, is what needs to be done. And it's just not on the agenda for the Navajo Nation, but I think it's the agenda for every single local health department and state health department, and CDC is trying to figure this out. And it will throw things at us that we don't expect, but we know we can be prepared, try to be prepared the best that we can each time.
Well, on that note, thank you so much for participating in this interview and also for all of your efforts throughout this pandemic. We really appreciate everything you've done.
Thank you, Megan.